The highly contagious coronavirus Delta variant is now the dominant strain in 5 states, including California. The CDC reports the variant now accounts for a quarter of new COVID-19 cases in the U.S. Not only does it spread more quickly, health experts say it is more deadly for the unvaccinated. Officials are also expecting another rise in cases after July 4th celebrations and travel over the long weekend. CBS News' Natalie Brand has more.
As travel surged over the 4th of July holiday weekend, health experts will be watching closely to see if COVID-19 cases follow suit. In Springfield, Missouri, cases are already rising. The number of hospitalized coronavirus patients jumped nearly 27% in the past few days. State health officials say they are experiencing a temporary ventilator shortage. Nationwide, doctors are noting a common thread in those most at risk.
If you're not vaccinated or not completely vaccinated, you should be very, very concerned.
Especially in the face of the highly contagious Delta variant. Doctors say it's 40 to 60% more transmissible, with indications it may cause more serious disease. The Delta variant currently makes up more than a quarter of all cases nationwide. And in Arkansas, Wyoming, and Nevada, states where full vaccination rates are below 50%, cases are also rising.
We're going to see a rise in cases. There's really little question about that. We're already seeing it. But we're not going to see anything that is going to be anything approaching catastrophic.
President Biden fell short of his goal for 70% of U.S. adults to have had at least one shot by July 4th. Now the White House is launching surge teams to parts of the country with higher rates of vaccine hesitancy.
Best defense against these variants is to get vaccinated.
In Texas, officials say more than 1 million people have skipped their second vaccine appointment, and a new poll finds that nearly a third of Americans who are not vaccinated have no intention of getting one. Natalie Brand, CBS News, Washington.
For more on this, let's bring in Dr. Richard Bresser. He is the president and CEO of the Robert Wood Johnson Foundation. He's also the former acting director of the CDC. Dr. Bresser, welcome. Great to see you again. So almost half of the United States reports rising cases of COVID-19. As we heard in Natalie's package there, more than 1 million people are overdue for their second shot in Texas. How concerned are you about this, and how do you think the Delta variant might play into it?
Well, I am concerned, Tanya. I'm very concerned because of the concentration of people who are not vaccinated. If they were spread out evenly over the country, it would be less concerning than the way it is now, where you see pockets of high concentration of people who have decided for one reason or another to not get vaccinated or have had challenges in terms of getting access. That means that there are communities that are quite vulnerable, where we will see continuing rising cases and, unfortunately, a rise in hospitalizations and deaths. It's not going to be similar to what we saw last summer, where we saw peaks and surges. And the reason for that is that we are seeing quite high rates of vaccination among older Americans, the groups that are at the greatest risk of severe disease, hospitalization, and death.
So that is a little piece of good news there. I'm curious about Israel's report Monday that showed a decrease in the effectiveness of the Pfizer vaccine in preventing infections and symptomatic illness, while remaining highly effective in preventing hospitalizations and serious illness. What do you think of that? And can we expect something similar to happen here in the U.S.?
Well, when you think about why we vaccinate, what the big driver it's serious disease, it's hospitalization and death. It's not to prevent mild infection. And so I'm actually encouraged by the fact that these vaccines appear to be quite effective when you've gotten both doses, quite effective against the Delta variant. That doesn't mean that there couldn't be a new variant that comes along as this virus continues to transmit that the vaccines are not so effective against. So we have to do everything we can to knock it down. But it's encouraging right now that these vaccines remain effective against all of the variants that are circulating. And hopefully that will help some of those people who have not gotten their second dose to get off the fence and go in and get it. And hopefully it will convince some people who have not gotten any doses to say, it's time, I want to go get vaccinated.
So keeping with that point, Dr. Bresser, more than 125 campers and adults who attended a summer camp run by a South Texas church have tested positive for coronavirus. What type of risk does the Delta variant pose to children right now? And what do you say to parents who may still be on the fence about getting their child, 12 and over, of course, vaccinated?
Yeah. Well, when you look at the data, I'm a pediatrician. I'm a parent. My first thing is, get your questions answered. Go see someone who you trust. Ask all your questions and get them answered so you can make an informed decision. There's so much misinformation out there that you have to go to someone who you truly trust. What I see when I look at the data is that the risk from these vaccines is extremely low, so much lower than the risk of the infection itself. And that goes true for children as well. 12 and older, you can get these vaccines. They're incredibly safe. And one of the things that we don't know, Tanya, is the long-term impact from having had a COVID infection, this kind of long hauler syndrome. What will that mean for children in the long term? What will it mean in terms of this unusual multi-system inflammatory syndrome that you see in a smaller group of children? I'm a big supporter of vaccinating all of the children who are eligible right now. But I don't think people should be badgered into getting vaccinated. I think they should be met with respect and have their questions answered.
Dr. Richard Bresser, always a pleasure. Thank you so much for joining us.
Thank you so much.